All right, so you're reapplying to the match. How do you justify changing specialties? What do I mean by this? So obviously, for me, I applied orthopedics the first time, and then I matched now into radiology. So when I reapplied for the match, I had to explain to the radiology programs what did I do and why this love for radiology, where did it come from? Was it the same day that I didn't match? I woke up and I said, "Oh, radiology is actually my true passion." I mean, who's going to buy that, right? So, let me explain kind of the first step for you to be able to justify switching specialties. One, you're going to do this during your personal statement, and then obviously in your interview. The first step, you have to justify it to yourself. Okay, so what do I mean by this? Let's take a step back and think. You have to decide, what do you want, right? Do you want to match right away? Do you want to do a research year? Are you going to do a surgery prelim? Do you want to do internal medicine and then a 3-year fellowship? Do you want to match into a surgical specialty where you finish right away? You don't have to do a fellowship. Are you willing to do 5 years of residency? Are you willing to do 3 years? Right? Because now, if you didn't match, it all starts over, right? You have the choice. Like, let's say I had decided I was going to do family medicine. This would be my 3rd year right now. I'd be basically done. Let's say I wanted to reapply to orthopedics. I would have had to probably do a research year, then do a surgery prelim, and then reapply, or reapply in the interim or whatever. What was I willing to do? So you can kind of approach it in 2 ways. If there's something you already know you love, then you pick it, right? If you've always wanted to, like I have a friend, he didn't match ophtho, and he told me, he said, man, honestly, I love internal medicine, so I'm going to go for ophtho another time, but I'm very happy to do internal medicine. He said that almost before he even didn't match, and when he didn't match, it became even more clear. He ended up matching ophtho, but he said he'd be happy with internal medicine. For me, I knew I wouldn't be happy with internal medicine, right? I mean, I even didn't. I even tried it. I said, let me try, and I didn't, and I quit after 2 months. Okay, but let's just say, for the sake of argument, that you decide, you know what, I want to be done. I'm just going to do internal medicine. Okay? And then what do you have to do next? You have to then look at internal medicine and develop a love for internal medicine. I don't know how that's possible, but that's what you have to do if you've decided you're going to apply for internal medicine. So in my case, I decided, you know what? I'm going to apply radiology. That's, for me, the next best thing. And so then I have to sit down with myself, I have to reflect, and I have to think, how can I make radiology not the next best thing for me, but make radiology the thing that I love? Because imagine going to work every day and loving what you do. Wouldn't that be such a blessing? And I did enjoy a lot of orthopedics, but I didn't get it. So now I have to... It's like a second marriage, you know? You're not going to be constantly thinking like, oh, if only it worked out with my first wife, right? Or if your first job doesn't work out, right? You're not going to be thinking, man, I wish I was back in where I grew up with my first job. I hope it worked. No, you need to develop like a sincere relationship with this new situation that you're in. And for me, the challenge or the task, it wasn't a challenge. I think it was easy, but the goal was fall in love with radiology. So what did I do? First thing is I reflected and I thought, and I start to kind of evolve my thinking and say to myself and remember differently or highlight, wait a second, when I was on my orthopedic rotations, how often did I look at imaging? All the time, right? Before every surgery, I looked at imaging. And I started to convince myself, I love that time. You know, it was like the funnest time was looking at the imaging, interpreting the imaging, talking about how the fracture pattern. I used to wish I could sit up front like the first year orthopedic surgery residents and get called on to interpret an image, an x-ray or whatever. And so that's the opportunity I have now. I used to love being in clinic and explaining to patients, telling them about their imaging, telling them about the finding, reading the CT scan with them, showing them their fracture, showing them their arthroplasty. What else did I used to love to do? I used to love putting in the note my interpretation. I'm dictating over here. Putting in the note my interpretation of the image, which is what? This is, patient comes in clinic today, whatever. I have an AP and lateral of the knee of the right knee showing, degenerative changing consistent with like osteoarthritis, joint space narrowing, cysts, osteophytes, whatever you want. And why did I love doing that? Why did I do it? Well, one, it kind of helped my reputation, my interaction with the attending, because the orthopedic surgeon attending can give their interpretation and bill for it. But at the same time, it's something that I could actually do as a med student, and I can actually contribute, and I could feel important, right? Because as a med student, you can't be going around drilling, but no one's stopping you from interpreting the images and putting in that best effort. So then what did I do? I rotated. I did 2 weeks with the musculoskeletal radiology program at my school, mostly with the director of the musculoskeletal imaging fellowship. And so I developed that connection, and I was in the reading room looking at shoulder MRIs and hip MRIs and all that stuff all day, right? And so I developed a love for it too. And so then now I think to myself and I say, in a year, I can fall in love with it. This is something that I can do. This is something that I can see myself doing happily, okay? And so then now the question comes when I'm interviewing and when I'm writing my personal statement. Okay, Cal, so we see here you applied to orthopedics the first time. You had acetabular fracture. Well, why? What interests you in radiology? Like, why do you want to do radiology now? And so I can, instead of making something up, all right, or instead of justifying it to the program director of radiology that I'm applying to, or whoever the interview committee is, no, I can justify it to myself, and I can just now be myself and express my sincere passion I've developed, and honestly say, the truth is, I did 4 orthopedic aways. The ball was rolling. I went ahead and I decided to apply to orthopedics. I didn't match. But now that I look back at it, radiology, it's the most natural thing for me, because truly, like when I was in the operating room, when I was doing my orthopedic aways in the morning, I would look at the images. I loved interpreting the images. That was like the funnest part. I would always comment. I would always ask about the images. What do we see here? What are we looking at? On top of that, in clinic, I love to explain to the patient about their imaging, their fracture pattern, talk to them about their CT scans, show them the anatomy. I love to give my own interpretation. That part was super fun. It was super fulfilling. It was super rewarding. And at the same time, now that I think about it, I enjoyed surgery, but radiology, it's the best of both worlds. Of course, I can do IR, but even if I choose to do musculoskeletal imaging, I can still do some procedures. I'll get the best of both worlds. I'm not going to be subjecting patients to the risk of infection, blood loss. It's minimally invasive. Think of all those benefits, those perks, how fulfilling that is, how much better it is than surgery. And on top of that, I can help so many people in one day, right, at one time, because I can go through scan. And I look back on my time doing orthopedics, preparing for orthopedic surgery residency, and I say that was time well spent, because now I've spent time in the operating room doing orthopedic surgery aways. And so as a doctor's doctor, as a musculoskeletal imager, I'm in the best position. There's a RSNA radiographics article that talks about shoulder MRIs. It's titled Shoulder MRI, What the Orthopedic Surgeon Needs to Know. So now I actually have that firsthand experience. I can be the best doctor's doctor, giving these orthopedic surgeons a great report, a report that actually helps the patient, a report that actually guides surgical planning. And, it's a team sport, and I'd love to be on the radiology side of things, whether it's MSK imaging or not. Boom. All right. That's an answer. And it's true, because I'm not giving up my passion for the musculoskeletal system, right? I could have done sports medicine instead, but no, I want to be interpreting images. I want the radiology aspect. I want to be a diagnostician, etc., etc. And that's why I love radiology. That's why I'm reapplying. That's why I'm reapplying to the match only to radiology, right? And obviously, I didn't tell them that I reapplied to orthopedics. But the truth is, I ranked radiology higher because I decided after doing a surgery prelim, I don't want to be in the operating room. I'd much rather sit in a chair in the air conditioned, eat whenever I want, pee whenever I want, dictate, pick up studies, etc. Right? Of course, during your interview, you're not talking about lifestyle in the interview, right? But everyone knows that the lifestyle is better, okay? And so you can justify it to yourself however you want, but you have to be sincere so that you can give a true, good, realistic, convincing explanation when you're reapplying to the match for whatever you're going to do, because that program director doesn't want to take people who are transient, all right? They want to take people who are going to stick to the program for the 3, 4, 5 years that the program is. And so if you're iffy or if you're a reapplicant, they expect you, if you're only going to a program so you can reapply, they expect you to do a prelim, not a categorical. So I'm telling you now, when you're applying to the categorical positions as a reapplicant, you have to develop that earnest want for this specialty. I'm not giving you any guidance on how to pick the specialty. You might say, I only have 3 years and I want to be done, so I'm going to do internal medicine or family medicine. But that means now you have to turn to those specialties and develop that love for them, okay? You can pick it however you want. For me, really, truly radiology was something I enjoyed, I liked. So it was natural to me, okay? And so I think it was an easy job to fall in love with it. But it's going to be a lot harder if you hate everything, or if you really were pigeonholing yourself and you only love ENT, you only love head and neck dissections. That's like your passion. Well, if you match urology now, if you're reapplying to urology, it's going to be really hard, like, for you to figure out bridge that gap. Whereas obviously from orthopedics to MSK imaging, I mean, that's pretty natural, right? So I'm happy to help. You can call me and you can email me. I can give you my number. I do interview prep. I'm happy to look over personal statements, anything you need. I just want you to match.